It's good to see you, Bill. it's
It was a
been,
long struggle, I know.
yeah, it's been a long journey. Uh, so, in a recent series of mass murders in Connecticut, Colorado, and Norway, we see young men who either carry or are presumed to carry an autism spectrum diagnosis, and families of ASD children and adult children are deeply concerned. So, do individuals with autism have a higher risk of psychopathology and violence later in life? And where is the silver lining, if any, around this cloud?
I think the answer, Dan, is a definite no. There are a lot of challenges and concerns for people in the autism spectrum, but I think this is not one of them. Um, for example, the school shooter in Connecticut was incorrectly identified as autistic in some of the early media reporting, and that's quite clearly not accurate. The Colorado movie assailant was basically a young man who had done very well in school and had never had any early symptoms until he had a mental breakdown. And basically, it appears he suffers from a delusional disorder, and I think the psychiatry would call it schizoaffective disorder, and that is not autism. And the Norway killer, who killed all those people in on this island near Oslo. Um, I've been to Oslo twice since then, and I've talked to some of the people involved, and basically, he too is apparently a schizophrenic suffering from schizoaffective disorder, which basically is a delusional disorder. And he also had no symptoms that resembled autism. So I think basically the answer is no.
I want to go to Bernie Rimland, who was an associate of yours, as I understand it, some time ago.
Yeah, I got to. I knew Bernie for a really long time, and then back in about 1988, we when he realized that I had the largest number of autistics probably in the world and the biggest chemistry database for autism, we started spending a lot of time together talking about what autism is, what the causes are, what the best treatments are. That was about 1988. Um, and he was concerned about the environment getting worse and worse, and that the words he used were in his book. He talked about them as brain cripplers, environmental insults that can cripple the brain. And this includes things like pesticides, heavy metals, over vaccinations of sensitive people, sensitive infants. And he thought that we were headed for not an Armageddon, but a future where there would be a lot of young predators who might do terrible things in society because of this worsening environment. And basically, I think he was absolutely right. We now know clearly that autism is caused by environmental insults, the so-called brain cripplers that Bernie was talking about. And and I think the question he was asking was, what happens for children who have a predisposition, are prone to autism, but manage to escape autism? They might get to ages 3, 4, and 5 without having enough of an environmental insult to cause the onset of autism. And I think the answer is a higher incidence of mental and physical disorders, including a higher incidence of violent crime, and that's actually happening already. Center for Disease Control now has data saying that 1 out of every 31 adults in America, male adults in America, is either in prison, in jail, or awaiting trial. So it's already beginning to happen.
You've said that people with antisocial personality disorders, ASPD, have a lot of the same biochemical abnormalities and epigenetic errors that you see in autism. So, what is the difference between a violent psychopath and the poor impulse control that I see in my 25-year-old son, Ben?
Well, I worked with so many violent sociopaths, hundreds and hundreds of them, and got to know them really well when I was trying to help them find jobs and make sure they had housing when they got out of prison. Um, they are really very, very different from autistics. Yes, there are similarities. There are biochemical similarities about nearly every accurately diagnosed autistic, nearly every autistic, and every sociopath. They're all very undermethylated. Both groups have generally very elevated levels of toxic metals like mercury and cadmium and lead. They both have OCD tendencies. They're obsessive compulsive, and they have poor socialization. Although their socialization is different. In the case of autism, often this is an absence of socialization, and in the case of the criminals, it's deviant socialization. And both groups have appears quite clearly that it's now looking more and more like that both disorders are caused by epigenetics. But there's the similarity ends there. The two groups are strikingly different, and I believe they're really totally different conditions. For example, the sociopaths that I got to know so well, they tend to have great verbal skills, and they've had good verbalization generally since they were very young. They were never plagued by food sensitivities or immune problems or yeast overgrowth, and not many of them had epilepsy problems. But the biggest difference between the two groups is actually behavior. More than 75% of the sociopaths eventually will have a history of a criminal arrest. More than half of them will wind up in jail or in prison. And when you look at the autism population, there's a very low crime rate, very low violence rate. So I think there's not much concern in general.
Let's talk about psychotropic drugs and those that are used to control behavior of mentally ill patients. Do they induce violence in ASD kids and adults? That is, do ASD kids or adults respond atypically to psychotropics? And what does your research reveal?
Well, my research and other research shows pretty clearly that giving these heavy-duty drugs to autistics is probably not a very good idea. The most common drugs now given to people with autism are the atypical antipsychotics, specifically risperidol or Adderall. Or Abilify. Risperidol and Abilify. These are atypical antipsychotics developed for schizophrenia. They've never been tested for safety for anyone under the age of 17, but they're now regularly given to 2-, and 3-, and 4-year-old children diagnosed with autism. The reason is that researchers in the Chicago area at a Chicago hospital published a paper that showed that risperidol and Abilify actually helps with reducing behavior problems in autism. So a lot of doctors are now giving these heavy-duty medications to very, very young people. The problem is that there's now been new research that shows that these very medications, risperidol and Abilify, that they actually reduce the volume of your cortex being the outer part of your brain that is where most of your cognition is. And in other words, they shrink the brain slowly and gradually shrink the brain. And a study at the University of Iowa showed that this shrinkage of the brain from these very medications is proportional to dosage and proportional to the period of time you take it. I really think that I just think you cannot justify giving these medications to people with autism, especially very young children who haven't completed the brain development yet. Now, with respect to the antidepressants that are often given to autistics, these actually are aimed at increasing serotonin activity, and this is fine for many people who have low serotonin activity, but there are exceptions, and we now know that if you give one of these medications to the wrong person, you can make them very violent. Getting back to the school shootings that happened in Connecticut and other places, there's been more than 50 school shootings since 1991. Most of them are different from other behavior disordered situations, and the difference is that most of these school shooters had okay behavior through development, and around age 15 and 16, they developed anxiety and depression. their doctor gave them an antidepressant, an SSRI, and for them it was horrible because these are people who already had elevated serotonin levels, and it appears pretty clearly that if you look at all these cases, more than 90% of the school shooters apparently had this problem because of the SSRI antidepressants. So I think it's not at all anything you can be confident of in trying to help a autistic.
The title of your new book is Nutrient Power, Heal Your Biochemistry and Heal Your Brain. That title makes a rather large claim. Can the brains of adult schizophrenics, psychopaths, ADHD, Alzheimer's, and autism be healed? And if so, how?
I think we are entering a really promising new era in mental health. The last 50 years has been the era of psychiatric medications, but now science has advanced to the point where we're now able to correct a lot of brain problems, a lot of neurotransmission abnormalities, a lot of problems with people who have depression, anxiety, bipolar disorder, schizophrenia, and hopefully autism too. We can correct many of them without having to use foreign molecules. The advances in brain science have been absolutely wonderful. So I think we're actually at the point where we can already use nutrients if we only knew what deficiencies and what nutrient overloads a person had, because nutrients are very powerful if used exactly right. Where do our neurotransmitters come from? Where do we get serotonin and dopamine? The answer is the brain's a chemical factory, and these things are made all day, every day in the brain, and the ingredients, the raw materials, are nutrients, amino acids, vitamins, and minerals. We're also learning from the new field of epigenetics that nutrients have a dramatic, powerful effect on gene expression, and we now know that autism appears to be a gene expression disorder. The most powerful chemicals in the human body, the nutrient factors that affect gene expression, are methylation, and folic acid, and I think this has a lot to do with the future of being able to help people without having to use drugs.
I know a lot of the work that you've done is with younger children, and is there anything that on the horizon that would offer hope for an actual recovery of ASD adults like my 25-year-old son, Ben?
Well, you're right. I've worked with more than 6,500 cases of autism, and most of these were younger people. And of course, it's always been a joy to work with early cases, people, children who might be 2, 3, or 4 years old. And the reason is that we were able to get, in general, much more rapid improvement. And I've personally seen hundreds of cases of complete recovery. But usually those cases were, we had to start before the age of 4 to bring them back all the way and have them be free completely of autism. And I think that's the same thing that I hear from my colleagues who are autism doctors. But the question is, how can you help an older person? We've seen hundreds and hundreds, probably at least 400 or 500 autism cases that where they hadn't started exploring treatment of this type until they were maybe 15 or 16 years old. And what we find is that, yes, we can help them. We may not be able to bring them back all the way, but we've been able to help them. We've used specific new therapies that are brain-directed therapies. For example, metallothionein promotion therapy. And there's a number, I think really the best hope for adults with a diagnosis are a combination of strong antioxidant therapies and brain-directed therapies. And unfortunately, there is very little research going on how to increase perhaps synapses in adult autistics. We now know that it's very possible to have therapies that will cause an increased number of brain synapses, the connections between brain cells. We know in autism there's a poverty of these very synapses, and that's got to be part of autism. Cognition, socialization, and speech. These all require literally millions and millions of synapses joining together and teaming to acquire these capabilities. So I think there's a really great hope for the future. I just wish there was more research aimed at developing these therapies.
So do I. And
Yeah.
I want to go into some of these future possibilities with you in more detail in another interview. But meanwhile, I just wanted to show your book again and say, this, folks, this is a really very readable book. It's got a lot of science in it. It's written in terms that I can understand. It doesn't waste your time, and it's been an eye opener for me. Bill is helping me with my son Ben, and we've seen very hopeful improvements in him. So, Dr. Walsh, thank you so much, and we'll talk again.
Well, it's been my pleasure. Thank you, Dan.